Flu fears and new hope from the lab that as fast-moving as the virus may be, it lacks the one key piece that would make it into a killing machine like the 1918 flu. Even so, late word tonight from Mexican authorities, the death toll there rising. It's now up to 16 confirmed dead. That's up from 12, and there are more than 150 fatalities suspected to be tied to the H1N1 swine flu outbreak. And just about everywhere, fear is still running high. Take a look. United Airlines flight from Munich, Germany to Washington diverted to Boston after a single woman complained of flu-like symptoms. All week, we've been trying to fight the fear with the best medicine we've got, the simple facts on the bug that's now responsible for 141 confirmed cases in 19 states in America and hundreds more suspected cases across the country.
On the front lines of a health crisis, boxes of Tamiflu ready for distribution across Alabama. One of now many states with suspected and confirmed cases of the swine flu. The numbers have exploded over the last several days, both here at home and beyond. But as the virus spreads, encouraging news from the World Health Organization.
We have no doubt that making a successful vaccine is possible within a relatively short period of time.
How short? Officials say scientists could discover the strain for the vaccine soon, but caution it may take at least several months before manufacturers can make doses available to the public. They also believe this influenza strain, also called the H1N1 flu, is not as dangerous as the one that killed millions at the end of World War I.
We do not see the markers for virulence that were seen in the 1918 virus.
At the center of this microscopic threat, a mystery about its origin deepens. Scientists have suspected this strain is composed of bird, human, and swine flu. But new genetic sequencing indicates the swine flu comes from not one, but two different types of pigs. One from North America, but the other from Europe and Asia. It's a surprising link because Eurasian swine is rarely imported into North America. Also, new details on possibly the first death from the flu. The New York Times identifies the victim as a 39-year-old mother of three from Oaxaca, Mexico. Showing signs of a bad cold in early April, her condition worsened with chills, pain, and a high fever. Her husband said she was reluctant to go to a hospital. When she finally did, it was too late. She died on April 13th.
The first victim. A quick reminder, this story is changing by the minute, especially the number of states and cases across the country. That's why we're continuously updating our interactive flu map, and you can find it at ac360.com right now. Now, some of the information comes from a nerve center deep inside the Centers for Disease Control in Atlanta, the CDC, and they've assembled a team of number crunchers, virus hunters, genetic sequencers, and other infectious disease specialists. They're tracking data, collecting samples, and working 24/7 to isolate a reference strain, a sample, if you will, of the H1N1 virus to be used in making a vaccine. Now, few people get a look inside. Today, 360 MD Sanjay Gupta did just that. Take a look.
After 5 days in Mexico, hunting down the first cases of the swine flu virus, I'm back in Atlanta. Now, if there's a place where every bit of news about swine flu is converging, it's here, the Centers for Disease Control and Prevention. Before they would let me into the main control center, a checkup, here, in the medical clinic, to make sure I wasn't sick. They tell me I'm fine.
So now we're ready to take a look at the nerve center of the CDC, something known as Emergency Operations Control. Take a look over here. Hundreds of people have been in here working day and night for over the last week. And take a look at those screens up there. Those screens monitoring cases as they come in, trying to put it all together, trying to piece it all together, trying to get control on this outbreak.
Everybody you see in here is here because of the outbreak.
What else do we have over here?
Each one of those regions that you see on that map right there has a team of epidemiologists and folks that are working on making sure that they track each one of the cases in that region. And so they are literally down there getting calls from all those states, talking to the state health officials, talking to the epidemiologists in each state, and tracking the numbers.
Tracking cases, looking for clues, sending out investigators. The guidelines on those Fort Worth school closings, they came from here. But today, the focus seems to be shifting. What if this spirals into a full-fledged global outbreak? And what if we need a vaccine?
I want to show you something that very few people get a chance to see. We're in the back hallways here at the CDC in the laboratory area, and look through this window over here. That woman is working on the swine flu virus. A lot of those samples come here. What she is doing underneath the hood, she's obviously protecting herself, is to try and check to see if the swine flu virus is sensitive to antivirals. What I can tell you, the early testing shows that it's quite sensitive to Tamiflu.
This particular virus, with this particular combination of genes, we've never seen before in humans or animals. It was totally new.
Michael Shaw runs the lab.
Are we making a vaccine?
Yeah, we're all learning right now. We're doing the best we can as fast as we can. which is the message I guess we really want to get out. We're working day and night trying to get this done.
Here's how it works. The scientists here at the CDC provide the virus for the vaccine. After that, it's in the hands of the manufacturers, the big drug companies.
Is a vaccine been recommended now?
No. We're at the stage where we're trying to understand this situation. We're trying to characterize the severity and the epidemiologic characteristics.
If history is any guide, over the next few weeks, H1N1 is likely to fizzle down. But come fall and winter, it could come back, making a vaccine that much more important and keeping the hundreds of people in this room just as busy.
Now, you talk about Tamiflu specifically. If you add up all the various doses, including the stockpiles, Anderson, there's over 100 million doses, so that's some good news. We also found out something very interesting this morning, about 8 a.m., about 500,000 doses, 400 to 500,000 doses were delivered from the United States to Mexico. That's something that they asked for, and the United States gave them, Anderson.
I talked to one teenage girl who was infected a couple days ago. After she had 103 fever, after taking 2 doses of Tamiflu, she felt better. How effective is it?
Yeah. Well, it seems to be very effective. It doesn't absolutely kill the virus, but what it seems to do is reduce the severity overall of the sickness and reduce the duration. There was also some very interesting modeling done where they looked at giving Tamiflu at the beginning of an epidemic or a pandemic and giving it to the close context of people who were sick as well. And what they found overall, if you sort of played that out over about 3 months, it reduced the number of people who were infected by 2/3. So it seems to help on the individual level, and also, if given appropriately at the right time, can really, really significantly reduce the number of infected people in a pandemic.